and body acne. What can you do about it? Acne doesn't just happen on the face. Some people get it on other body areas as well as the face, and some people don't have it on the face but do get it on other body areas. And common affected areas are the back, the chest, and also the bum, the bottom. The first thing I would say is when we're talking about faces, it's quite a nice easy area to reach and to treat, but imagine trying to do a complicated anti-acne skincare routine on your back. Unless you have help, it's quite difficult. I would start first of all by thinking around lifestyle here, because there are several things we can do. One is to look at whether sugar or high dairy diets could be contributing towards your acne. Now, don't try cutting everything out at once. I would try cutting one thing out at a time, maybe for a month, and see if your acne is better. Then you know what's working and what isn't. There are also brilliant supplements. So zinc is a particularly good supplement to take for breakouts. I recommend this for face acne as well. But if you think about when you're taking a supplement, you are treating your whole body. That will reach the other areas really nicely as well. And also anti-inflammatories like curcumin or green tea extract and vitamin A can have a good role as well. Taking all of these things can really help to address the whole body skin. It's also worth thinking about what you're doing around an exercise routine. So, for example, obviously sweat itself isn't dirty, but if you leave sweat sitting on the skin, it can become a perfect growth medium along with the sebum and so on that your skin is releasing for bacteria that can then lead to spots and breakouts. So I would always recommend showering pretty soon after you finish your gym routine, then making sure that you dry off properly and get yourself dressed. When it comes to topicals for body acne, there are some products which are now available which may contain AHAs or BHAs or even retinoids. But the problem really comes down to how to apply them, because you can't reach some of these areas that efficiently. If you live with someone who's happy to give you a helping hand, great. Get them to apply some salicylic acid solution, for example. But do think about the fact that often these areas are subject to more friction. So as a woman, we usually wear bras. And if you do develop some dryness or skin sensitivity, and then you've got an item of clothing that's rubbing against it, you may find that you get sore more easily on these areas than you would on the face. Another tip that I find quite helpful, and this is one that I use on holiday with sunscreen if I don't have someone to ask to apply it to my back, is I have a fake tan applicator wand which I use to reach those hard to reach bits that I can't reach with my bare hands, and something like that could help you. If your acne on your body is really severe, then it may be worth talking to a dermatologist whether or not you consider treatments like Roaccutane, for example, which is a prescription. There is, launching in the UK at the moment, a new laser called the Aviclear, which is particularly licensed for treating acne, and there are some very reputable clinics with this device, and it's also in the hands of some amazing dermatologists. So I would always say looking at a systemic approach first is going to help when you're looking at these body areas. Really thinking about lifestyle, diet and nutrition before you start jumping on the bandwagon of lots of topical products which can be difficult to manage on the body, and really thinking about those high-level treatments in cases where it's needed. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.